slide for introduction. Okay, Concha, thank you.
Thank you, Maria Grazia. Welcome everyone. My name is Concha Martin from MediPIET network, and I'm happy to be here in this last webinar of this phase. We would like to tell you how to work during this session. We will kindly ask you to mute your microphone in order to avoid any background noise. And in case you have a bad connection, it's better to switch off your videos also in order to keep the full connection for the presentations. And regarding the questions, you can ask your questions at the end of the 3 presentations. You can do in 2 ways, or unmute yourself at the end and ask your question, or write it in the chat for everyone, and we will be able to read it and to address it to the specific speaker you want to. So from my side, these are the housekeeping rules. I switch and give the floor to Maria Grazia. Thank you so much to all for attending.
Thank you, Concha. I am Maria Grazia Dente. I am here to introduce this webinar, the 3rd one of a series of webinars on public health and social measures in the context of the COVID-19 pandemic. I will give, in short, the floor to Dr. Luigi Bertinato, that is the head of President Scientific Office, and will give us the welcome on behalf of our President, Silvio Brusaferro. Only some words on this webinar. We will try really to focus on the panel of our speakers. You will see that they will share with us very interesting aspects related to communication and way of coping, let's say, or making efficient the public health and social measure in COVID-19 prevention and control. We have today in the panel 3 speakers: Dr. Marge Reinap from the World Health Organization Regional Office for Europe. And then we have Tihana Karic from the Institute of Criminological and Sociological Research from Belgrade, and Valentina Possenti from National Center for Disease Prevention and Health Promotion at the Istituto Superiore di Sanità di Roma. We will start with the welcome, and then we go through the presentation of our guests. I will only introduce the speech, and we will have discussion at the end of their speech, because you will see that their speech are very complementary each other's. So it's better to wait the end of their presentations to have a whole discussion among all of us. So without delay, I remember to switch off, please, your microphone. You will have the chance, as Concha said, to say your comments or to ask your questions at the end of the 3 presentations. So please, until that time, mute your microphone. And without delay, I really am happy to give the floor to Luigi Bertinato for his welcome. Thank you, Luigi. The floor is yours.
Grazie, Maria Grazia. Thank you. Thank you so much. I have the great honor to welcome all the participants on behalf of Professor Brusaferro. She's the president of the Italian National Institute of Health, and so greetings from Rome. And the Institute is the promoter of the webinar. Together with the MediLabSecure network, of which the Institute is a partner. The MediLabSecure network is a network founded by the European Union with the aim to strengthen an international network of public health institutions and laboratories in 22 countries around the Mediterranean region and also in the Sahel area, in order to promote a real great integrated surveillance of a vector-borne virus and arbovirus, in particular, adopting a strong One Health approach. We are working in coordination with the MediPIET network, which is a regional network that engages countries of both sides of the Mediterranean Sea in a special training program in the field of epidemiology, which is now co-organizer of the current webinar in which all of you are involved. I have to say that since the start of the COVID-19 pandemic, these two networks have reoriented their activities. The Institute, in the framework of the MediLabSecure in particular, have set up the training course on preparation and response to the health emergency of the new for the new coronavirus, which is the adaptation of the course that the Institute offered to Italian health professionals starting in the first week of the pandemic during last March 2020. Today's webinar, therefore, follows on from the distance learning course. It is the third of a series of 3 meetings on public health and social measures, each with a regional focus. They will allow us a direct exchange on a theme that remains central for all countries from the Mediterranean to the Sahel. And it's now my duty to thank all the organizers, my colleagues from the Institute and all partners, and to wish to all of you an excellent exchange of experience around the meeting. And again, welcome to the seminar. Now I give the floor back to Maria Grazia, if I'm not wrong.
Luigi, thank you. Yes, you are not wrong. Okay, so this is the turn now of Marge Reinap, Dr. Reinap, from the World Health Organization Regional Office for Europe. Thank you, Dr. Reinap, for being with us. She will focus on what are relevant, feasible, and effective approach to promote acceptance, uptake, and adherence to physical distance measure for COVID-19 prevention and control. Thank you, Dr. Reinap. Please go ahead with your presentation.
So first, one thing probably you haven't learned is to properly unmute your oneself.
Sorry, so Dr. Reinap. Dr. Reinap,
no,
I don't know the others.
Thank you so much for inviting, and it's a pleasure to speak.
Sorry, Dr. Reinap, can you hear me?
On a very important topic. on how we ensure that the public health measures, public health and social measures we introduce and implement is accepted, they are updated and sustained. So let me share now the presentation. So Maria Grazia, do you see the presentation?
Yes, now
Perfect.
yes. Thank you very much.
Now you hear and see it as well. As Maria Grazia introduced, and I'm Marge Reinap, and I'm technical officer on supporting the health policy development and implementation unit on bringing evidence to policy development. And today I'm going to talk about a recent report that we did in a series that is called Health Evidence Network, that synthesizes research evidence to policymakers to make better decisions. And as you can see, this report is already 72. And this is the first one in the series that was focusing on COVID-19 prevention and control. And you can see it was authored by group of authors from Australian University. And the main authors are Rebecca, Ryan, and Sophie Hill. You have there also the link to the report, and I'm sure we can make it available also in easier format, the full report. So I'm going to give a little overview of what we found during these evidence synthesis on relevant, feasible, and effective approaches on how we can promote the acceptance, uptake, as well as adherence to physical distancing measures in order to prevent and control COVID-19. So just as a starter, why? What is the issue? Why did we look into it as the main focus? We all have seen how important the public health and social measures are and have been and continue to be to manage the COVID-19 pandemic. It is really important to implement and sustain the behavioral change. And we all know how difficult it is to change people's and populations' behavior. And it has been challenging. And therefore, there has been a gap and really understanding on how to promote the implementation of such measures. And we really wanted to go back and look what we have learned, what the evidence says about this. And first, what is that we think about is physical distancing. I think we have all learned to, and we know what they are, but just to give you the approach that we took in that report, and really starting by that mentioning and reinforcing that when we at times we talk about social distancing, physical distancing interchangeable, but here we really mean to the aim is to reduce physical contact as a means to interrupt transmission rather than reducing the social contact alone. And these were the measures that we looked in the report: contact tracing, crowd avoidance, which means the reducing the virus transmission in crowded areas, mass gatherings, and individual distancing in homes, shops. So isolation, quarantine, school measures, as well as work measures, and for schools, and that also applies at the closures of these activities. And what did we search? The authors adopted deliberately a very broad approach in looking different ways on promoting physical distancing. And we wanted to to assess evidence with wide-ranging purposes. And as you can see, the different approaches cover the provision of information, reminding and reinforcing messages. The pictures that I have chosen for this slide is taken yesterday from my walk, and as the regional office is placed in Denmark, and unfortunately these are Danish, but these are really to remind. We all know, and we have told that we have to keep physical distancing, but this says that don't forget to constantly keep distancing, and have a good day, but please keep the distance. So this is to remind even now people in Denmark that is opening up, that we need to be reminded. But it's also the two-way communication, sharing of information, support for behavioral change, engagement with affected people, and involving the decision making. And we used the taxonomy of the Cochrane Consumers and Communications Group. So what evidence we searched and what we found. So the evidence search took place until May 2020. So probably by now there have been some newer evidence on COVID-related COVID-related evidence emerging, but unfortunately not that much more efforts being on clinical research. We looked at published and unpublished sources and all existing papers in English from 1942 onwards, and several databases were looked at. And among 3,428 papers, 31 were relevant for the review, but this also included more single studies because some of them were systematic reviews, and 18 were COVID-related. But also Ebola virus disease, MERS, SARS, and tuberculosis had provided evidence on how to communicate in these epidemics and outbreaks. And it had a very broad geographical range of 35 countries and all WHO regions. So, and what was found? And 6 themes were emerged from the evidence, and giving you a bit of flavor to the main findings. More information and details are in the report, and I encourage you to further read that. So the first theme that we looked at, that the authors looked at, were really the features of publication and how to communicate what exactly. So in the first slide, it's a bit busy. Focus on what the content of the communication is, and how to really reach to the population and individual. Really being clear, comprehensive, and consistent, and also providing a rationale. Why do you have to do that? Why do you have to keep physical distancing? And for any other change requirements, people need to understand why they need to do that. But also to provide content in your communication to encourage individual to enact those changes, and to show how and what they can do. And also it's important to not only focus on what is your personal benefit or personal what it means only to you, but also on the not only personal protection, but also the altruistic actions that needs to be taken on behalf of the community to really prevent the transmission. And also provisions of reassurance that support will be available for people to complete the required measures. And what is very important is that really you have to be transparent in your communication and acknowledging uncertainty, what is known and what is not known at any given time point. And it's especially important and has proven to be very, very important. This is in the case of emerging and changing epidemics and outbreaks. And tailored to the needs of different groups. I speak a bit more about this. And also, it's not less important to really convey the messages about the actions that authorities are taking to control the spread of disease and to support those undertaking physical distancing measures. And regarding timing and duration, three main key points from here is that you have to keep public informed over the course of the outbreak. Start as early as possible upon pandemic recognition and updating continuously, and really to ensure the accurate public knowledge about risk reduction measures, including physical distancing, and about how to comply with these, and really related to the topic about the content. And clearly inform about the expected duration of required measures, but also keeping in mind and keeping the exits open that things may happen and change. So they communicate also of the possible changes to end dates that might occur due to the uncertainty of the timeframes and epidemics development. And variety. On my pictures, you only see posters, but it is also important to include information and share information and various sources and disseminate it across multiple platforms, methods, and channels. So we cannot go with one source only, the source and outlet. And the second theme was who are the audience, the recipients of public communication, how to reach better. And it gets more difficult now. And it really is that it's complex context, settings, and audiences to be, there are differences in these audiences. And they need to be targeted differently because knowledge about and also adherence to preventive behaviors are not evenly distributed within the population, and tailored to the messages to vulnerable, hard-reached population groups, language barriers, educational disadvantage, and also those with cultural background, and also inequalities present in the population influence acceptance, uptake, and adherence. And theme 3, support for individual population behavior changes. Here, the population as a whole and the individuals need to be targeted, and positive social attitudes and norms on physical distancing are very important. Also strong social pressure for adherence, stigma related to physical distancing measures needs to be proactively addressed. And communications occur with a context of structural and other issues such as lack of support and financial issues lead to non-adherence. And you have to address, provide information on what are the support services and, for instance, information on different areas that the population people may be concerned with, how to get usual medical care, how to access social services, mental health services, so needs to be also embedded in the complex communication strategy. Community engagement to support communication. Involve local stakeholders and engage the community in planning and communication of the outbreak response. And there are many good positive aspects to it. It improves acceptability. It is the communication and public health intervention take the local conditions into consideration, and also community values, which are important as well as there always are alternative channels for communication with communities. And what we have seen, trust is important, and it is a bit of virtuous cycle, and you have to have some trust from authorities, including governments, but also timely, transparent, easy to understand, and consistent communication by those authorities help to improve the trust and to build that, and then it would facilitate also the better communication and also acceptance, uptake, and adherence to public health measures. And finally, sorry to rush through this, but as you can see, there were lots of different points the evidence told us. And that one key area that we made a separate theme was the distancing measures in schools and workplaces, because these are key. That the consistency of messages, both to parents and employees, are important, as well as stressing here the why. That was one of the recommendations or one of the findings of some earlier themes, and also understanding that what are the benefits from school closure. Also address the issues of potential income loss. Think of the solutions and support, what is needed and how you communicate, and also communicate the mental health support. So this is really a complex picture, and it's not only one size fits all. But key messages, just final slide to conclude, is first, it's really important that the authorities, the government, have their defined roles, and the lines of communications are very much aligned, and also communication happens between community and public health authorities. So as building on what I talked about earlier, it's to ensure clear, consistent, actionable, and timely information about all aspects of physical distancing, including collective benefits and harms, but also supports and services. Tailor information and support to reach all groups within populations, and explicit considerations need to be given on any inequalities and needs of hard to reach and vulnerable populations, and communication, community engagement in developing and disseminating information, as well as you go along, and assessing regularly what you are doing, measuring the risk perceptions of populations, and also for what is the impact and attitudes and behavior. So you can go and tailor your strategy to really address different aspects of what needs to be communicated. So I thank you for attention, and I also think, if this picture is from the WHO new website on vaccine information, and I think this, I'm not a communicator myself, I'm a I'm a policy. I have been a policymaker and a person on evidence, but these tools and these suggestions are not unique only for physical distancing, but can be applied to all measures, as well as it's really also aligned with the risk communication and community engagement guidance that WHO provides. So thank you for the attention, and looking forward to discussing with you.
Thank you, Dr. Reinap. I really appreciate your presentation. Many of us are not communicator, as you say for yourself.
Now, Maria Grazia, you are muted.
No. Concha, can you unmute me?
No, you are unmuted.
Yes, I can hear you. Yes.
Okay, I try again. I was thanking Dr. Reinap because it's true that many of us are not communicators, but I think that we'll really, grow up a lot of considering the
Maria Grazia, I don't know if I don't hear, but you may be muted.
Can you hear me, the rest of the audience?
Yes, we can hear you. Yeah.
Yes, Maria, we can hear you, the rest of audience. Thank you.
I don't know which is the problem. So anyway, I will, sorry. So what I'm saying that the 6 themes that were addressed to me are really very pertinent and important, and I'm going to connect to one of those that you mentioned, Dr. Reinap, the one related to the public trust for what the political authorities are doing in the case of emergency like the COVID-19. I'm saying I'm connecting to this, giving the floor to Dr. Karic, that is reporting to us, especially on this aspect. I mean, on COVID-19 conspiracy, belief, and containment related behavior, and the role of political trust in Western Balkan countries. She will explain to us how these beliefs can hamper the trust in the political authorities during the emergency. Thank you, Dr. Karic. The floor is yours. Thank you very much.
Thank you. Can you all hear me? Just a short check. Okay. Good afternoon, everyone. As I'm already presented, my name is Diana Karic. I am a social and political psychologist working at the Institute of Criminological and Sociological Research in Belgrade, and I will now share my screen, my presentation. Is everything okay?
Yes.
Okay, thank you. So I will be talking just a little bit about conspiracy beliefs, because we are all aware of their influence on the pandemic itself, on the prevention behaviors, but also on the vaccination specifically. When we were doing this research in the first half of the last year, at the beginning of the pandemic, there was no word of vaccines, but there are some newer studies that assess those things. But I will talk about prevention behaviors and how conspiracy beliefs influence prevention behaviors, and what is the role of political trust, or so to say, the trust in institutions in that relationship. So in order for a belief or set of beliefs to be considered a conspiracy belief, it should fulfill 5 conditions. It should include non-random patterns, so everything is planned. Intentional agency, coalitions or groups of human or non-human actors. We have different theories. Hostility and pursuing evil goals, and continued secrecy, of course, except that many conspiracy theorists know about these happenings. And what is interesting for conspiracy beliefs is that people who believe in some conspiracy theories tend to believe in other also, who are often unrelated or even contradicting. So, for example, we have studies that show that people believe that Princess Diana is both dead and alive. So this is very interesting, and that led the researchers to think that there is a superordinate, so to say, belief that was called conspiracy ideation or conspiracy mentality, that actually is a tendency of people to hold conspiracy beliefs. Conspiracy beliefs flourish especially in societal crisis, which is defined as impactful and rapid social change that calls existing power structures, norms, and conduct into question, or even the existence of specific people or groups. And if we look at this definition, we can see that this pandemic actually fits this definition perfectly. Why do people hold conspiracy beliefs? Because it helps them make sense of ambiguity that is present in these crises. It also helps them maintain the illusion of control when there is a lack of information, especially at the beginning of this pandemic when there were not enough information, not even for the scientists. And there is something that is called major event, major cause bias, or so to say, people tend to explain major events by major causes. They cannot imagine that there is some virus that jumped from an animal to a person for some reason, but they need something more to believe in the existence of the virus itself, but also its importance. Why is it important to understand and fight conspiracy beliefs in health-related contexts? I have already mentioned vaccination, but also for other prevention behaviors. And there were not actually many studies prior to COVID-19 that explored this relationship, although conspiracy theories and conspiracy beliefs have been present in the humankind probably since forever. Actually, these influence public health behavior, not only in this COVID situation, but prior studies explored the roles of conspiracy beliefs for HIV or AIDS and for Zika virus, for example. And they also find that people who tend to believe different conspiracy theories are less prone to prevention, but also to intervention. People who, for example, who have HIV, if they hold conspiracy theories, they will not adhere to intervention, they will not take their medication. So that is a real problem. And one important factor that emerged in the not so many previous studies is actually political trust, or the trust in authorities. In the health-related context, Marge has already mentioned this political trust as a very important thing for helping promote prevention behaviors. And in this context, it would be the judgment of citizens that the system, as well as its representatives and institutions, are responsive and reliable, and that they are legitimate, trustworthy, and acting for common good. So these are the characteristics of a trustworthy political system. And actually, health officials and leaders have to persuade the public to adhere to prevention. And this was done with more or less success in different countries. In Serbia, the situation is interesting as in any other country, but for us that follow the situation closely, the first case was officially declared on 6th March, and the state of emergency was introduced only 9 days later and lasted for a month and a half. But what I have to mention is that this state of emergency was actually heavily disputed both by the public and by the experts, and that already decreased the trust in a government that was already considered authoritarian. And it was found that rules of crisis communication were actually violated, and that damaged trust to key institutions and individuals. Valentina will talk more about the importance of communication strategies in situations like this. but I will just give an example. There were different experts in our crisis staff that gave contradictory information about the virus or the influence of the virus and so on. So even the people who were involved in the crisis staff itself that made all these decisions gave sometimes even false information about the virus. In this study, we wanted to see, is there an effect of conspiracy beliefs that are related to COVID-19 specifically on preventive behaviors? And does political trust mediate this relationship? Does it change this relationship? And also the preference for saving lives or saving the economy, that was that is one of the dichotomies present in studies around the world. So should we focus on saving lives, or should we focus on saving the economy? Because we cannot do both, probably. We had 349 participants at time one. Time one was just after the first case emerged in Serbia, and 440 participants at time two, which was during the state of emergency, which was followed by curfews and other measures. And we measured COVID-19 conspiracy beliefs. We included beliefs that were present mostly on social media in the comments. Bill Gates was not as popular then in Serbia, so we did not include him in this scale. But we isolated two scales, so to say, two factors. The set of beliefs that the virus is harmless and that the need to take care is exaggerated, and hiding information that authorities, as well as world authorities, or so to say World Health Organization, but also Serbian authorities, are hiding or distorting information about the virus. Then we measured containment-related behaviors recommended by the World Health Organization. Political trust, we asked participants how much they trust the government, president, prime minister, health system, epidemiology experts, or so to say crisis staff, and Ministry of Health, and to handle the crisis, the COVID-19 pandemic. And we also measured their conspiracy mentality, because we wanted to see whether our scales, conspiracy belief scales, are okay. And of course, we asked them whether they prefer saving lives or saving the economy. Short about these results, these are the differences between time one and time two. Time one was, just to remind you, before the state of emergency, just after the breakout of the first case in Serbia, and time two was during the state of emergency. And what can be the most easily seen is that containment behaviors, preventive behaviors, emerged significantly at the second time point, and this could be due to two things. One of them is that there were measures that were enforced. And the second reason is that the introduction of this state of emergency actually led to the perception that this crisis is even more serious than we thought at the beginning. So we do more to protect ourselves. The beliefs that the virus is harmless have almost not at all changed between the two time points. So people who believe that it is harmless continued believing so even when the situation was stressed as more critical. And people who believe that the true information is being hidden or distorted about the virus and about the pandemic itself actually believed that more. So people tend to believe more that the government and the other authorities in the world are sharing false information, and that is interesting from the point of view of political trust. These are relationships among other variables. I will just shortly stress these. For example, hiding information and the belief that the virus is harmless actually correlates significantly and highly, so that to say people who believe in one tend to also believe in other set of beliefs, to hold other set of beliefs. And what is important here is the relationship between these beliefs and protective behaviors. Here we have the time point before the state of emergency, where we see that the more people believe in conspiracy theories, the less they adhere to prevention. At the second time point during the state of emergency, these correlations are even higher. So people who, this relationship became even stronger when the state of emergency was introduced. I will skip this because of time, and I will lead you directly to this path analysis. What we see here is the following. So we have the belief that the virus is harmless, that predicts significantly that if we believe more in this conspiracy theory, then we will adhere to prevention behaviors less. Then we have, we have preference for saving lives that directly influences or predicts these prevention behaviors. So to say, those people who believe that we should work more on saving lives tend to adhere more to these behaviors, which was logical and expected. But what we also have here is this political trust variable that actually this conspiracy belief about COVID-19, as when this belief is stronger, then people tend to have less trust in government and institutions, and having less trust leads to less prevention, less adherence to preventive behaviors. So if we trust the state more, then we will adhere more, and this is one of the findings that was also supported in other studies after ours around the world. This is just for your information, something that is very interesting for me. It is from two different studies. Another one is not yet published, but this is the comparison of political trust between time points. The blue line is during the state of emergency, and the red line is the beginning of this year, in February and March this year. The trust in institutions in Serbia decreased compared to last year and the state of emergency. And as we can see on the scale 1 to 5, when 1 there is no trust at all, and 5 is complete, I have complete trust in these institutions, we can see that only the health system is trusted above 1.50, which is very worrying, if you ask me. And just shortly about some implications and recommendations, why people should, the governments should actually take care about the ways they communicate and motivate people to adhere to containment-related behaviors. And more about that you will hear from Valentina. But also this political trust is important for general policy support. Because if people don't have trust in authorities, they will also tend to support their policies less, including these COVID-19 related policies. And those poor policies and poor enactment of these policies can actually lead to bad outcomes, not only in the economical and health-wise sense, but also regarding psychological effects. And some of tips about fighting conspiracy beliefs. There has been a study published maybe a month ago, 2 months ago, about populism and conspiracy beliefs, and why I have reported on that here a little bit, because the measures that have been introduced in Serbia have often been populist. So in these kinds of systems, like the most of the Western Balkans, people will tend to believe the authorities less, but will believe their fellow populists more. So the states should engage in bottom-up messaging from the people, should be telling people. And it is also discovered that corrections to misinformation might not work for these populist attitude holders. And why populism? Also, again, because it is considered to be a political manifestation of conspirational thinking. So that is why we should also take that into account. I thank you very much, and I'm looking forward to discussion.
Thank you very much, Diana. As you see, the issue is really taken from different aspects, from different aspects of the problems. When you were speaking, I was wondering, I hope that our authorities and our politicians are aware of all these, and they really maybe should be also our role to really inform them how their actions and their all what they put in place should be really well communicated in a way that people are not really thinking about any conspiracy, but really instead could adhere on what authorities are. I'm also happy that at least health service, health sectors has some, but there will be time for discussion because, as you mentioned in your presentation, in this situation, what is really needed on the basis of the evidence that you and Mark reported to us is a very strategic communication, let's say, path. So for this, I happy to leave the floor to Dr. Possenti, to Valentina, to have her time to explain how in Italy we try to cope with the problems that were raised so far. Valentina, the floor is yours.
Thanks a lot. Good afternoon. Thanks for this slot on the issue of communication strategies during emergencies. And in the meanwhile, I am trying to share the slides. I hope to have succeed. I don't know if there is the slides on the screen.
Yes.
Oh,
yes,
perfect.
thank you, Valentina.
Okay, thanks a lot. Yeah, I would say, well said, Maria Grazia. In fact, the real challenge in a matter of communication strategies during emergencies, and now we think about COVID-19, it's hard. It's quite easy to say, but hard to put in practice, we can say. I am Valentina Possenti, as Maria Grazia said, researcher at the National Center for Disease Prevention and Health Promotion of the Istituto Superiore Barbara De Meo, who is the head of the unit where I work at ISS. And I would start by this sentence. In the next influenza pandemic, be it now or in the future, be the virus or environment, the single most important weapon against the disease will be a vaccine. The second will be communication. Why is this statement? Because it was 2009, it was by John Barry. We already had SARS or avian flu, and it was prior H1N1 pandemic. Unfortunately, we can say that some years later, it describes something that is very applicable to the current situation due to COVID-19. And in general, public health emergencies of international concern is
Valentina, maybe you need to remove your video because we cannot hear you properly.
Okay.
Thank you.
I'm doing, sorry, because I don't know why there is a very poor connection today. And you can see the slide as well?
Yes. Yes, thank you, Valentina. We can see it.
Valentina, remove your video. Okay, thank you. You should remove your video, otherwise we cannot follow you.
Yeah, I understand. The problem is with the connection. I don't know why today is very, very low. It's very scarce. Or what about now?
Okay, go ahead. Thank you.
Not a lot. I don't know why today is a very bad day for the connection. And we were saying that during the 21st centuries, after epidemics, pandemics, so anyway, public health emergencies of international concern, we had several lessons learned. And the measure one was that response actions can be successful only if they rely on a solid emergency plan, which includes also preparedness issues as well, and effective risk communication based on participatory approaches. We had the European decision it was 2013, it was the number 1082, and it confirmed that communication is part of emergency management activities and is fundamental to build up trust and credibility on one hand, and active collaboration, particularly, and it's about what the other two colleagues have been shown before. All of this is essential in order to get health protection that in turn represents one of the main determinants of economic well-being. Then pandemic plans need to be processed and finalized, but when there is not an emergency on the horizon, because they have been shared by the different level institutions, from the international level to the national and local, when identifying roles, responsibility, and basing on scientific evidence and networks of real competencies, in order to associate prevention interventions to define timing and quality. And this is an article published in 2014. It's about pandemic communication during H1N1 pandemic in 3 countries, England, Italy, and Hungary. The concluding evidence is that whether there are failures in preparing, it is already a problematic condition for failing. And it's a matter of participation, but what does it mean? In several fields of public health, we can think about non-communicable disease prevention, or more in general, health promotion strategies. We have a shift from simply involvement to core citizen engagement. And it's not just a shift of terms, but as also colleagues have been showing before, we talk about participatory strategies in public health during the last 2 decades. We can say concepts as participatory research strategy or scientific citizenship have been gaining ground and have become crucial also within pandemic or major outbreak communication process. Or we have empowerment. That is a key in a promotion since late 80s. And the rationale of applying such this concept also to emergency communication is that we will have a far better chance of tackling these grand societal challenges via inclusive participatory approach if all societal actors are fully engaged in the construction of cooperative solutions and actions. And it's not just, we can say from the institution perspective, transparency and participatory dialogue with citizens pertain to the responsibility that organizations, authorities are in charge of. We know that public trust levels are predictors of people compliance with norms. We have seen, for instance, social distancing, as said before. Even health literacy, fundamental in public health, becomes a group skill, not an individual competence, but of a network, of a community, in a context of shared decision-making between health sector and users overall. Let's look at this picture. Birds on the rows, namely individuals, are in different lines, and pandemic communication acts in this way. We are all in it, but differently, not in the same way. And so If you would like to enumerate communication keys in pandemics and epidemics, we have them. Here we are. Necessary. The first one, governance. Again, reading clockwise, engagement, no? A key keyword. And then the gender patterns, science education and participatory approaches, open access to data and scientific outcomes, fundamental nowadays. We cannot think about something secrecy on what is the scientific evidence going on. And then, not lastly, but ethical aspects, all pertaining to law and fundamental rights. And just to give an example, vaccination is perfect because we have social issues, ethics, gender, responsible research, innovation, people inclusion, engagement. It actually is a current health challenge. It's a matter of coverage. And then we have new facts like vaccine hesitancy and anti-vaccine movements. Furthermore, we said vaccine hesitancy. If we look at one of the model that I think to well represent this highly complex public health issue, we can see that on all the four sides, on the top, on the bottom, left side and right side, we have communication-related entry points. And we have been working on several European projects in these last 15 years, and it's one of them. It was called Tell Me. We are in 2014, and I here represent one of the main figure that the project generated, that is this framework model, and the innovative point was that at the center of the communication process overall there is the public. Relevant stakeholders are on the circumference and all other elements in between. Such a framework was tested during the different pandemic phases from the interpandemic to the transitional recovery. And there is another one. It was more complex. It was more recent because it ended 3 years ago. And this European project was called Asset, and entailed all the aspects which intervene in case of epidemics or global pandemics. In the end, we got this hexagon with all stakeholders, and the public now is one of them. At the center, there is the core of all, that is MML, mobilization and mutual learning. Fundamental because we exploited this hexagon, and each stakeholder, each target group correlates with actions. With action to improve an effective pandemic communication. And I don't know if you remember the 6 keys that I showed before. For each of them, we have, again, actions that go in the direction of improving pandemic communication. So what? This said, the COVID-19 pandemic was not necessarily new about communication aspects, we can say that. But the problem is it was a real watershed, a pervasive and truly global pandemic that we didn't not have before something similar, I mean, in the contemporary world. And it was quite difficult to apply what we have learned since previous experiences, because as I said before, when I started, something easy to study and to say, but harder to put in practice, because in the beginning we did not have vaccines, and the available measures were only about individual protection, environmental control, physical distancing, and cross-border use. So all the measures that the colleague has shown before. An editorial on the Lancet defined the infodemic condition due to exceeding amount of information with evident consequences of risk perception among people. And that the vaccines came. And here we are still in the process, and the complexity has not decreased. Some years after the European decision I was mentioning, in 2020, WHO and the CDC explicitly addressed the relevant role that risk communication, community engagement, and multi-sectoral collaboration have in the COVID-19 pandemic management overall. And it is necessary that the communication process is planned, organized, and coordinated, because we always say that there is a multi-stakeholder approach. We said that public at the center, it's relevant, but the advocacy is in the health sector is in charge of the advocacy. The coordination role that is fundamental, because in order to build a strong community engagement, we should have a clear distinction of roles and responsibilities, and an integrated use of available communication means and channels. And it's not something easy with social media advent and all we know, but at the very base, we have the determinants of trust and credibility, institutional reliability in risk communication are the same than those theorized by Covello more than 20 years ago. And they are active listening, commitment, dedication, competency, honesty, empathy. Such an approach can tackle infodemics, can contribute in managing rumors and fake news, which
Sorry,
really...
Valentina, you have 2 minutes maximum.
I have finished, because other elements have been already mentioned: uncertain communication, risk perception, and the risk of stigma. And the last as well, it's the role of professionals. They are essential in order to activate all those elements that we have said, and they are the importance of the interpersonal communication that they have with the public, with the citizen, in clinical and in community settings, and the importance of building up and maintaining active the network. That's all.
Thank you, Valentina. I'm sorry to really to push you, but we would like to have time at least for some questions or some comments from the audience, because we fixed always a very short period for this webinar, because we know that people are very busy with all the other things, and we start to understand that they appreciate the short meeting, very focused on some pressing issue. So sorry for being a bit nasty sometimes. And Concha, maybe you can help us. Is there any questions or comments? There are people here in the audience that are facing the problems that were discussed so far in the presentation. Please, besides asking, you can also comment. You can say what is happening in your countries. You are many connected, so I hope that, I mean, you would like to share something with us. I know that it will be great and fruitful.
Yes, in fact, I don't see any hand raised, but you can unmute yourself and ask your question directly. I don't see any hand raised so far, but
may I add something while the participants are maybe contemplating? I forgot to mention the situation in other countries in the Western Balkans. There were no studies like this that I have found, but nevertheless, this relationship between political trust and prevention measures is confirmed in many other countries and many other studies, so it is pretty robust. But I have some information about the trust in government. In Albania, it is in the last year it was around 30%. In North Macedonia, it fell from 46% in July last year to 25% in September last year. Those are the information from the National Democracy Institute, and I can share this information with my presentation if necessary. And Marge mentioned timing, clarity, and variety of information to be of utmost importance, but I would also say truthfulness. So the information have to be true, and they have to be correct, factually correct, and there shouldn't be any contradictories between government officials that are reporting from different positions. So the government has to have one unique strategy to influence the motivation of people to prevent the spread of disease. Thank you.
Yes, we have a question from someone called user. So please unmute yourself and say your name and country, please. I unmute you. Can you please unmute yourself, someone called user, and ask your question? Okay. Well, it seems that it's maybe by mistake that is in such a way. I don't know if there is any question. If not, I have one. But let's see if there is anyone else that want to ask something. So if I may, Maria Grazia, may I ask?
Of course, go ahead, Concha.
In fact, I was thank you for your excellent presentations. I enjoyed a lot. I was wondering two things. First, how we can keep the adherence to the control measures when there is such a population fatigue regarding to social distancing and all the other measures regarding COVID pandemic. This is my first question. Well, let's go with this one and keep the time for others. Thank you. It is not addressed specifically to any one of you. I thought on this in the second presentation.
Could you please repeat once more, because
yeah, how we can keep the motivation of the population to keep the adherence to the control measures, to respect the distance or to isolate themselves or keep the mask or whatever, when these measures have been asked to be taken during so long time. So people are very tired already of the pandemic, of the consequences, and all these changes in the daily life we are all suffering. So how can we face this, and how can we increase the motivation to keep the adherence to these control measures? What are your suggestions?
My suggestions based, for example, on these data that I have presented is to increase trust in institutions ASAP. So that is probably not going to happen in the Western Balkans, but governments should definitely try and increase trust, and that is by all these suggestions that were presented by Valentina and by Marge, especially with communication, but also people, so how to say, the good behaviors, or so to say, the helpful, the preventive behaviors should be somehow reinforced. I'm not thinking about any financial reinforcement or something like that, but people should be given more freedom, a little bit by a little bit, because that will help maintain maybe some level of control, but also help people, give people some freedom. In some countries, for example, in the Western Europe, in Germany, the situation with the measures is even more strict than here, and people are starting to to go against the rules, and that is expected. So these strict regulations have to be decreased, but maybe gradually is the way. Not all at once, as we did in Serbia. We did that, the restrictions were lifted 2 or 3 times within the previous year, and then the number of cases surged immensely, and then we were all closed again, and so on. So that is not the way, obviously.
Yeah, there is another question in the chat that I share because I was going also to ask on this. Is from Sondes Derwish. Sorry if my pronunciation is not correct. And is asking, how can we be credible in communication if there are several stakeholders? I don't know exactly what she or he meant. Maybe he can also explain better. But was also a point of concern of me. What do you suggest how to behave in order to really be able to consider all the stakeholders involved since the beginning? Because this is not easy. I mean, at least in the countries that we know is not easy. So how do you suggest to involve the stakeholders from the beginning and to deliver a message that could be credible for all the stakeholders involved? Is for you all who thinks that can have some advice will be welcome.
Yeah.
Yes, of course.
I don't know. I mean, it's not an answer that can give the thrust on this, but what we have been observing in these 2 decades from the first 2000 is that if we want to, we have to think about credibility not as an outcome, but as a process. And building up processes is not something that we can do in response time. I mean, you have to work for building up credibility, institutional credibility. I mean, they are very long process, and you have to do this when there is not a pandemic on the horizon. You have to, it's a matter of preparedness, no? Because if we look at pandemic plans, they are not a pandemic response plan. They are pandemic preparedness and response plan. This is very important because terms mean something. And moreover, it's about the processes, and it's about, I mean, institution. Sometimes we think that a spokesperson is he or she is the institutional voice of that institution, but it's not enough. Credibility is built on the territory. It's why I was showing the last slide on health care professionals, because and COVID-19 has showed this with all the strength in a pervasive way, because citizens, if they think that a vaccine is reliable, or if they are compliant with the measures like wearing masks or social physical distancing, it's because they trust, and the trust is a very long way. In literature, we know that there is the post-trust society. No, it's about after the H1N1, we have data that the trust in institutions in responding emergencies was very low. But why? Because pandemic, the H1N1 was not a full pandemic, so risk perception in people was very high. Then as the pandemic was going on, people say, oh no, and it's why the colleague show conspiracy theories. They are very long process. So there are concepts to build in over time, over the years, and they are very country specific because we think that is a public health matter, but it's about social issues, cultural issues. So it's not that, okay, we can share experiences, Italy, but in each country, I think something different happens. And so several lessons learned, but every time there is something more to put in practice.
Thank you, Valentina. Now, Marge, please.
Yes, just to complement what Valentina said, and also to bring the attention to also one of the points that I tried to make, but really hastily at the end of my presentation as a key message, is that it's also important to ensure that there are these lines of communication between the different stakeholders, and you share information, you are in the same information environment, you establish these groups or lines of communication. As Valentina said before, the best is to do that before the pandemic hits. And there you create the trust, you share, and you understand also your strengths in communicating and reaching out to different audiences, but really to ensure that there is a consistency of messaging. I remember from my work earlier when we established a group for vaccine related communications in country level where I worked, to really bring in all the national authorities and share the information, also the inquiries coming in from different journalists, and being also consistent in how you respond to the queries. So I think this is indeed a critical area of work to establish these lines of communication, the same information sphere, that you understand each other, and build on trust, which is I think a key theme that came through, but also trustworthy, credible, transparent communication is also a key to build the trust.
If I may add shortly.
Please.
I don't think that there is a country in the world or a system in the world that will handle or would handle any pandemic perfectly, because it is a very complex system of elements, and it cannot be handled perfectly because every country has also its limitations, or the financial or of other nature. But these things are very important, and what Marge now just said, that what I also emphasize, that different sources of information need to provide the same information about different things, about important things. So we cannot have two different doctors, members of the crisis staff, saying to opposite information. So that just leads to distrust, and people don't know who to trust and what to believe. And that, of course, leads to distrust. That is also an important. I just want to confirm that that is really important.
Thank you, Tiana. Concha, if there are not other questions, I would like to.
Yeah, so far I don't see any hand raised. Yeah, I had a lot of questions, but I think that we are over the time already. So.
Anyway, many of the participants asked if the presentation will be available. Yes. As Concha said at the beginning, the webinar is registered. In fact, we saw that many times many participants cannot participate during the time proposed, but they can have access to the registration afterward. And so I would like to have 2 points, and after Concha suggests maybe to have a picture all together, that would be nice. My points are these. For some of you, MediLabSecure and MediPIET is something new, so let's say, but these are two networks of really many countries collaborating together for preparedness and response to health threats. When the COVID-19 pandemic explodes, we both reconvert our activities on capacity building on COVID-19 emergency. And for this, we have a capacity building process that started with a workshop that was, let's say, discussing at the, after 4 or 5 months from the starting of the epidemic. We were discussing the action taken at country level in order to cope with the pandemic. At that time, we were only speaking for vaccines, so mainly the measure were public health and social distancing measure. Then we have these 3 webinars. Thank you really also to the other speakers that are not with us today that participate in the other 2 webinars, because they were very much appreciated, both for the webinars, both for the fact that also a briefing note was disseminated with each of the webinars. So with additional note for those that are interested in deepening their information on these topics. And now what we were trying to do is to conclude this process with the last workshop on, let's say, I cannot say a conclusive discussion, but at least an advanced discussion on action taken and lesson learned during this pandemic. We would really like a lot to have this workshop in presence. So for this, we are delaying a bit the announcement, let's say, of this. We hope to have it maybe by the end of the year. So we will be really happy to have, I mean, all the representatives of these webinars participating in. I would like also to add that although this time we focus on COVID-19, MediLabSecure activities and MediPIET activities will continue on the aims that, let's say, the original objectives that we had. And so, for example, MediLabSecure, will have a network meeting in June to resume, let's say, to restart the activities that were concentrated at the beginning on surveillance of vector-borne disease with a One Health approach. So, having said that, if there are not further, let's say, comments, and of course, saying again, thanks a lot to the speakers and to the participants, to Concha and to the others that from behind are helping us to search for, let's say, comments and whatever is happening during this webinar. And really, this is an arrivederci, as we said in Rome. So this means see you at the next appointment. And please switch on your video that we take a picture.
Thank you, Maria Grazia. Switch on your video and smile, please.
More. Okay, thank you for being with us.
Yeah, please wait, because I need to put the follow. There are a lot of people, so we really need to have the picture of all of them. Sorry, it takes some time.
Yes, we wait for you.
Sorry. It's not that easy. Yeah, it's working now. So I'm looking for the following page. In case there are others. So there are a lot of people that are not switching on their cameras because probably they are connecting from a. Oh, someone else. Let me take another one.
I saw a lot of friends. I hope to see them in June in the MediLabSecure meeting. We really look for seeing you all. So thank you very much, Concha. It's over?
Yes, it's over. Thank you very much to all of you. Thank you for connecting to this webinar, and see you soon.
Thank you to all. See you. Thank you, really. We appreciate.
See you in the real life soon.
Yes, you are right. Bye-bye. See you.
Goodbye.
Bye.